Talking Tuesday. It's what we do. We just sit around, smoke a pound, and talk about what we do in the cannabis world. We gon' let you know how the business go on a brand new show. Talking Tuesday. Show you how to do it right.
All right. Welcome to Token Tuesday. This is Marco, and this is Ruby to my left. We normally got Virgil running everything and doing his thing, but unfortunately he's not feeling too well today. So shout out to my brother, and I hope you feel better. And then we usually got my man Keith over here to the left as well. But shout out to Keith. He's here. He's here with us in spirit. Matter of fact, he's actually here with us, arriving. You know what I'm saying?
Nice.
So we're looking forward to him being here on the panel and leading us on and sharing his expertise. But yeah, that's us today. You know what I'm saying? Doing what we do, and I'm here to share a little bit about the industry. So
One thing that I recently was reading about is being cannabinoid deficient.
Yeah.
So being cannabinoid deficient is I feel like the answer to everything, because everything kind of starts with your gut, and we have the most cannabinoid receptors in our gut and our brain, So I think that's why not any government agency is going to move forward. They know it, but they're not going to say anything.
Well, okay, 100% you're right. But I think really what I'm pointing to is two things. So if you're telling me that they have a patent which has empirical data attached to
they
it,
do have it.
from 67, from Raphael Mechoulam, because remember that's who discovered the endocannabinoid system.
Yeah.
And you also have a patent for dementia, Parkinson, and Alzheimer's. My question is this. There's no one that's willing to read these documents and say, hey, here's a solution, or hey, here's what's at the root cause of it. Now, what's funny about it is I think we all got ChatGPT. I play with it around. So I posed that question to Chat, like, hey, Chat, based on our diets, and, I kind of listed out, our diets got a lot of sugar in it, low fiber. There's so many preservatives and chemicals on the food to preserve the shelf life that a lot of times once it gets inside our body, there has to be more stomach acids produced to actually break it down. So when you really, really look at it, the food is contributing to making us sick. Also the inactivity. Mm-hmm. A lot of us have these sit-down jobs where we're not actually active anymore. Mm-hmm. So just the deterioration of your muscles with the poor diet. So why wouldn't you literally say, hey, you know what? One of the things that we can do to reduce the chances of you getting dementia, the chances of you getting Parkinson, is eliminate these things out your diet. And it's as simple as the omega-6s, right? Because that's literally like when you look at our diet, what is it leading up to? More omega-6s versus the omega-3s, like the healthy avocado oil, the healthy olive oil, or even
hemp seeds.
Even hemp oil. You see what I mean?
With omegas 3, 6, and 8.
Yes.
So
my question is, so they just gonna watch? Like Dr. CB, he mentioned this. Like, what type of society feeds a person food that's going to make them sick and just sit back and watch them die?
I think the one that wants to control them through the disease, because there's just, look at what's happened. There's so many natural holistic doctors that mysteriously.
Yeah. And since we're having like high moments, because to me there's like a high moment, like it just feels like a high moment, these questions that we're posing. But to me, that's I'm just gonna join the high moment. I think let's say like you're just like looking at the world down, and the world is a board to you, and you're just like some maniacal people that are just looking down on a board, like and you can do whatever you want. Like when you kind of look at it from that perspective and that lens, it's kind of like they have to lower the life expectancy for many reasons. In their eyes, because when you look at societies and you look at the planet and you look at people, I fascinate myself by that, by going to different regions and just seeing like life expectancy, just like animals, a dog's life expectancy, a bird's like ants.
They do that all the way down to
everything's
zip code.
Life expectancy is so interesting, a day, an hour. Some things are friggin' 5 days, a year, 20 years, 500. You goddamn life expectancy all over the place for different creatures. But it's very interesting as humans. We probably just, depending on where we are, because of properties, land, it's all, money driven as well. That it's almost like, as long as we could eliminate people as fast as they're born, then, I don't know.
Well,
You know what I'm saying?
Listen, let me tell you. Not only do I know what you're saying, there's a name for that. Eugenicist. Like literally, they sit back and say who deserves to be here and who not.
Yeah.
Like, how did the Planned Parenthoods get in our community?
Yeah.
How did our communities become food deserts?
Yeah.
So you literally have to, like you just said, look at it from a macro view where you could kind of just sit back and say, okay, based on, all of these inputs, what actually is the results that they wanted?
Yeah.
Death.
Yeah.
Because, I mentioned this to you guys. So back in Chicago, in Garfield Park, every year I would do a 5K run. And it initially started just from that community being affected by fentanyl.
Yes.
So it was like 60 people that died from fentanyl-laced heroin packets.
Yeah.
And, like to me, that's where I was born and raised. Like 3217 West Walnut, that's where they brought me home from, which is the Garfield Park community. And for me just to see people, whatever state they in, dying and no one really giving a care about it, my whole thing was, hey, neighborhoods, hey, whatever we are, let's come together and try to figure out a way to pause these massive deaths.
Yeah, yeah. And what's interesting when you look at it that way too, it's like, when you look at like, I don't know, maybe I'm tripping, but I think when I'm watching YouTube and shit, it's like Sweden and Netherlands and Swiss and these places, their young population is very low. Yeah. So those are the places that like to preserve elders. You know what I mean?
Yeah.
Like you have to look at it that way as well. Like certain countries aren't really about the preservation of the old.
Yeah.
You know what I mean? And then certain countries thrive off the preservation of the old. But then you look at their population of like young and it's not that much. Those countries aren't constantly reproducing, but they're preserving the old. They're old 90s, 80s, and they get old, so they're preserving them, as opposed to other places. It's just, our birth rates are crazy for some of us. I think, I don't know, you could tell me, but Africa, I hear in like 2050 or some shit, is the reason why people are looking to that continent in general is because it has one of the largest young populations.
Yeah.
You know what I'm saying? Like it has one of the largest like youth, like when in 2050 they'll have a lot of people because they still have a lot of young people, while many of us, even China alone, is struggling on that. From having that rule of only being able to have like one child or whatever. So that is interesting.
It's a reality.
It's the reality, So it just depends where you want to live. You want your life to be preserved, go to Swiss.
I think
if you want to roll the dice and be self-reliant and have to be super smart, what the U.S. makes you do, it makes you have to know shit.
Yeah.
Because they're not doing it for you.
Yeah.
Certain countries are like, look, we're going to help you be healthy.
They're hiding it from
Here,
us,
they're
actually.
like, if you know how to be healthy, great. But we ain't going to tell you shit. We're going to just give you whatever you want to take.
Yeah. I'll be healthy. They're like, I'll be healthy, but you could not, because a lot of people in government, they have a healthier lifestyle.
Yeah.
Well, here's the one thing, and thank you so much for pointing it out. I think we do always talk about these things like it's the boogeyman, but the reality is this: cigarette companies been buying food companies since the 80s, and that food has been adapting to be more addictive since the 80s. So, we don't have to be so hands off where we saying them, they, us. The reality of it is it's a little bit on both. We have not been able to what I call, it's the nuclear family. Everything's rushed. Everything got to go in the microwave. Like, my mom was a stay-at-home mom, and it's like probably all the way up until the point I think I went to high school, and then she went and got a job at that point. Like, it was some meals there when we got home from school. It was some expectations there when we got home from school. The only reason why I point that out, when you look at today's environment, these are the components that are missing. It's like a note, hey, your food in the microwave, push the button and eat it. Yeah. There's a cost for that.
Yeah.
And we have to start walking around like, these quick decisions don't have long-term results.
Oh, they're gonna have long term.
And if you have a microwave in the house, throw it out.
Yeah.
Because I don't have you'll never find a microwave in my crib, man.
Yeah.
You putting it on the oven or you putting it on the stove.
Yeah.
Or you eating that motherfucker cold. You know what I'm saying? But we ain't zapping nothing.
Yeah, listen, it's funny that you say that, but I don't think people quite understand how dangerous microwaves are.
Yeah.
No.
Like, from the container that you warming it up in to, like, the sound waves themselves. Like we at a certain point just really got to start looking at this and saying, hey, let's slow down and see what we actually putting in our body. Be more intentional. Like, just think about it. Being a descendant of slaves, we had a large part in agriculture and how food was grown.
Yeah.
And at a certain point, it was like that little garden that was over to the side had some, had
your herbs,
your yams. It had stuff that,
and we healed through that.
Yes.
You heal with the better. But that's why I keep saying they don't want us healthy, because the healthier we are, the more conscious we are, the more we're going to think for ourselves, the more you're going to question what they're doing,
Right.
And they manipulate us like that, because if you attack the gut, you're going to attack everything else. Then you're easy to control. Everything kind of ties in with each other.
Yeah.
And I think that's why big pharma, tobacco industries, Monsanto, they're the ones that are killing us.
Yeah.
And
you know what they're saying? Ignorance is bliss.
yeah.
That's how a lot of people are anyways.
Yeah.
Yeah.
Like, they say if you knew better, you do better.
Yeah.
A lot of people know better.
Like,
and they
people
don't
go
do
to
better.
Starbucks, right? and Starbucks throws the food in the microwave. And you're paying all this, like we've been hearing about their coffee that, it has a lot of bad things in them, a lot of, preservatives and chemicals that are bad for us. Yet you see this long line for Starbucks, and people know.
Because it's the sugar.
Yeah,
If you mess
addiction.
with sugar, is the number one addiction.
That's true.
You know what I mean?
That's
So
true.
Well, no.
anything we
Sugar
talk-
is not.
What is it?
Salt.
Oh, salt's even worse. I
Salt
thought it
can
was
kill
sugar.
more people than sugar had.
No, I mean addiction though. Like I
Sugar's
think,
like
salt
crack.
will keep you up.
yeah, because I read sugar.
Like, think about it.
Let's-
Later at night when you in there eating them potato chips, that salt keeping you up.
Yeah, but I think sugar
think
does
it's
more
sugar, though.
because sugar's going to feed cancer, and sugar's going to feed other diseases.
And not only that, you know how it is. Test it out with your kids. Jokingly, I always joke and I go, okay, this is how I know what kind of fiends my kid's gonna be, because when I give them sugar, I get to see what kind of addicts they are. You know what I'm saying? And I'm like,
true, though.
okay, all right, so you crazy. Oh, you kind of chill on. You kind of
Yeah.
chill.
You have
No,
one that'll
you got to
be
see the
hiding-
come down. That's where you really know who
You
they
have
are.
one that'll be hiding the candies.
That's what you see. And you're like, yo, with salt, but I think with the sugar is like for real, like that first rush.
Yeah.
No, the only
Yeah.
reason why I point to salt, like, a lot of people don't realize, like, eating meat is so bland that you have to, like, spice it up, right?
Yeah.
I remember when I think we watched the movie What the Health,
Yeah.
and we decided to go vegan, right? I think we did it for about a year. I never struggled with blood pressure, never, right? But my doctor was like, "Oh my God, what did you do?" Like, us stop eating meat, it cut our salt intake because of how you spice your
the
food.
seasoning.
So no chicken getting salted, no beef getting salted. Like, the vegetables, you don't really put salt on it. It's more like lemon or some type of herb to kind of balance the taste out.
Yeah.
But my doctor was like, "Oh my God,
Yeah.
like what's going on? Your A1C, where everything just went down." And then, I just told her, I said, well, it was a diet change.
Yeah.
She was like, "I wish more people would do that."
Yeah. And it's a trip. I mean, I ain't gonna call out my white folks, but I know a lot of y'all anyway, so I'm gonna have to say what I gotta say. But a lot of them, they don't use salt or butter.
Yeah.
So you got that demographic that sometimes their shit be bland because they ain't using nothing.
Yeah.
Well,
You know what I'm saying? So you're kind of
But
like,
how can you eat it at that
but they'll
point?
eat
I'm
the
not
shit out of
eating
some
it.
sugar though.
So wait a minute. That's the funny thing about it. Like, when you don't put a lot of salt or sugar
wanna
on your
eat it.
food, you're able to control how much you eat better. Like, literally, it's like you eat till you full and you just like that. it's the salt and the, like, think about it. They put MSG in salt. Why? Because it's like, and it's like you gorging yourself. I've never,
I don't
like,
know nobody who don't like MSG.
hey, put it on my chicken.
I love me some MSG.
But no, like, you have to pay attention to, like, the small habits, because it's the small habits that you do all the time that lead up to these bad results that we have.
I agree. Yeah.
Now, so here's the other interesting thing that I want to point out about other nations getting ahead of us in cannabis, right? So think about it. The American market has been around since 96, right? Probably, we're going to say longer than that, but legalized, known markets. Well, how is it possible that, okay, since, and this chart is just since 2020, how is it possible that Portugal, Germany, Thailand, Uruguay, and Canada are all in front of us?
Yeah.
And it really,
I think that's because they just decided to do
right by their people.
No, I just think their business model just is different because Germany doesn't have big domestic sales.
Yeah.
You know what I'm saying? Like, everybody has a different business model. As a Panamanian person, like, our family and my people are, like, big on importing and exporting. So that's just importing and exporting. It's its own industry. Yeah. You know what I mean? And then you have people who have the domestic side that comes from the importing and exporting. But if you look at those places, besides Thailand, they don't have crazy sales domestically.
Right.
You know what I'm saying? Like meaning like amongst, how we do. Like, we're way
some
more
of these
booming
countries
of a market.
only export.
Yeah,
so it's not for them, it's for the mass.
Yeah.
Yes.
Yeah. You know what I mean? And then when you're doing that, we don't know how much government is involved too.
Well, you know what?
You know what I mean? In terms of, like, the why are you allowed to do it? Maybe the government even has more hands in it.
The only reason why I point this data out is, think about this. The war on drug that America initiated was around the world. So literally whatever policies we created here is literally every country had to abide by. So if you really, really, like, see this as face value, I think others are saying, you know what, hold on one second. Like, was it as bad as you said? Like, my GDP is going down because I'm using less money for medicine because my medicine actually is helping people.
Yeah.
Mm-hmm.
So the only reason why I'm pointing to this, I'm saying that, like, because of our stance and how we policed it around the world, like, has people looked at that as, oh, you was just holding it back from me. Now that I know that I got a cash crop that I could go to the world with, I'm going to do my thing now.
Yeah. But I think, what it is? I think we're kind of sitting back and just watching and letting and seeing and studying the market and letting everybody else play. Because at the end of the day, nobody still has a bigger name than we do. Yeah. So the minute we decide to flood it, we're going to super flood it. I feel like the minute we do decide to go that route, there's nothing better, like Virgil says as well. Like, what don't care if it's Canada or what. Once weed comes from California, it's a wrap. You know what I mean? Like, it's gonna take over anybody, Germany, whoever. It don't matter. Like, they don't got clout like that. Like, we could sit back and watch, and then once we let it go, we're dominating just because of where we're from. Everybody wants our shit anyways. They're more mad that they're getting it from Germany and they haven't let us do it yet.
Yeah.
And now,
you understand what I'm saying? Like, other places
are
more probably like, God damn it, we gotta wait till they decide. And then once California and our places open up, it's like, yo, man, forget all these fools. Like, we want that. Like, that's what it is.
And I agree, because when I was working near LAX, people would travel and they brought a certain amount of money that they knew they were going to spend on cannabis. Mm-hmm. So a lot of people would purposely bring like 2,000, 4,000, and their idea was to go to different dispensaries to check out the California weed, because we are known for that.
That's what we do. Mm-hmm. So even though we're kind of not, I guess, doing it, I think the moment that we do, we're still going to have an advantage because of our reputation, and people probably they're waiting.
So I got two questions just based on that arena, like the rest of the world versus us, or us versus the rest of the world. Why does the U.S. struggle with federal legalization while Canada, Thailand, Uruguay have nationwide policies? Like, that's the first question I have. And then the follow-up to that would be, what lessons can the U.S. learn from these global markets?
I think they do it to control. I'm gonna maintain my thing because there's just so much that they have gotten away with, and it's a trillion-dollar industry that they can manipulate through that.
Yeah.
And I don't think it's that they don't know. I think it's that they don't want everyone else to know, because the less the normal person knows, the better, because they're going to get sick, they're going to go to the doctor, they're going to take the pills. But if you have someone that's thinking for themselves, as using cannabis, as using, things that were created on earth, you're going to think for yourself, you're going to question it. So if you have all these people that are questioning the government because they're thinking for themselves or outside of the box, they're not for that,
Yeah. I think
Marco?
mine always goes to economy.
Okay.
Right? It just, because it goes back to the bread. I ain't no genius. I don't know nothing, but I be watching a lot of TV, a lot of YouTube. I be reading a lot of Google. I just be zoning out and going into the rabbit hole.
Yeah,
and I'm always
because once you go down that hole, you're not coming back.
Rabbit hole. So because I'm down a rabbit hole, I just gather random information, whether it's right or wrong, but I just gather it.
Mm-hmm.
And I think if I also just put on my little thinking cap, I think those other places have to do that, because that's what they're kind of known to do. Like, Canada's kind of known to always be a outwardly investor.
Right.
Like, they don't take in investments, they put out investments. That's why they're the second largest landowner in the United States of America.
Oh, yeah.
You know what I'm saying? So, like, Canada's always, that's their whole game. Like, they rely on sending their things out for other populations to give them their worth, right?
So look, I want to pause your question to say, don't America need money right now?
Yeah, no.
And then you just said that people want that California cannabis.
Yeah.
So why wouldn't we tap into this global market? But go ahead.
Yeah.
I'm listening. I'm a student over here.
Absolutely, and I got you there, because I'm gonna follow up with that one too. But and then you places like Uruguay and places like Germany and even Thailand. Like, even though Thailand's popping, like, that population's very small. Like, these other places that we're talking about, it's like they have to do that.
Yeah.
Mm-hmm.
We still have Walt Disney. We still have Warner Brothers. We still have the NFL.
Yeah.
We still have the NBA. We still have
Hollywood.
Walmart. We still have Amazon.
Yeah.
We still have Apple.
So
We still have so many things. Of course, I'm saying the cannabis would only add to that. But what I mean is, we're still in a different position than all those other people who don't have that.
Okay.
So it's almost like, I feel like strategically they should faster. Not saying we
Right.
shouldn't, but if you're asking me why those other people are doing that already, it's almost because, like, it just, like, they have to.
Yeah.
So
So
I think over here we have.
don't forget the follow-up question.
Yeah.
What's the lesson can the U.S. learn from these global markets? So
I
that's
think
the
they know the
follow-up
lesson.
question.
I think they're just waiting to pull the trigger when they want to pull the trigger.
Okay.
I don't think there ain't no lesson they ain't been learned.
Yeah.
I just think it's about timing. You know what I mean? I don't think this is the question about lesson. I think it's more just timing.
Okay.
And whoever's pulling the strings is just, there's a timing for it. But everybody knows the lesson. This is like 1 + 1. Everybody knows what 2 is. It just depends, when you want to finally say let's go.
I think for me, the lesson that they should learn at this point is they would make more money to make it healthy, to make the country healthy again, like make America healthy again. There's more money to be made because if you think about it, especially with cannabis, and we've talked about the endocannabinoid system. So if we know that every human being has this system, then doesn't it make sense that you're also going to make money in keeping people healthy, because they're going to also need it to serve, because it's part of the human anatomy. So I always think about that. It's like, why haven't they thought about that? Like, I get it. There's money in people dying from cancer. We've seen it. We've been going through it. People have suffered. Don't you think it's time now to just go the other way? And how about we make money off of making people healthy? Because there's
and that's it. I think that's what comes down to what we said earlier. And this is my thing to humans and even friends when I see them. I think Gandhi said this: don't try to change the world, but be the change you want to see in the world. So at the end of the day, it's one of those where it's like, you really just, it's an internal thing, and it's a self thing first. And if those around you want to follow suit, then great. But really, you got to know better, because that's just the way the world works. We can't hope that the powers that be care about us. We got to care about us.
Yeah.
Now, listen. I agree with both of you guys, like 100%. I'll just add my little 2 cents in to say this. Like, we have Elon Musk, and whatever people think about the job that he's doing. This Department of Government Efficiencies, it is actually eye-opening. It's saying, what can we do to reduce the federal budget so we can utilize more money to take care of the American citizens. Yeah. I'm all for that. Like, I'm a nationalist. I want to see us do better because I have children. You have children. I want to see a better world for my children, right? Yeah. I think it's about 20% of our federal budget is for Medicare. So it's back to what you just said, Ruby, right? At the very least, when you want to reduce how much money that you're spending on sick people by trying to get less sick people.
Yeah,
absolutely. But if you really want to eliminate the problem, which the problem will never be eliminated, it's like trying to get rid of McDonald's, places like that. True. So that's great that you're doing a 20%. You know what I mean? To that, but when you have McDonald's on every block, that's why you need a 20% because everybody's still unhealthy. Yeah.
So wait a minute, listen to this. So America's war on drugs shaped global cannabis laws. We will all agree, right? Yep. So how are countries like Mexico, Thailand, South Africa breaking free from U.S. influence?
In what way?
In how they are presenting cannabis to the world. Like,
they have to.
Wait, I'm sorry. What did you say?
People have to. You have to give it its own identity.
Necessity, what you're saying.
Yeah, like you have to give it its own identity, but I don't think you're breaking through from the influence,
Well, I think the question is more or less to say, like, the war on drugs demonize cannabis.
Gotcha.
Yeah.
So anybody that's right now seeing it as a cash crop and actually moving forward to try to, bring in revenue with it, they went against that whole demonization. Yeah.
And I feel worse for my Jamaican homies. Because to be honest with you, forget us. Like we're like, California is California, but let's be honest too. It was that connection with reggae in Jamaica.
Yeah, the roster.
Like it always went hand in hand. You feel me?
Yeah.
So I feel more bad for them because everything you're saying is absolutely true. But the people that we overlook that had the most influence is them, the Jamaican homies.
Yeah.
You know what I mean?
Because I got a question in here for that too. So you know what? Like, I'm enjoying this conversation. Like, if you think about this, Rastafarians had more of a sacrament, like use for cannabis, like
more spiritual.
That,
you know what I'm saying?
Like, we just looking at it as basically a cash crop.
Yeah.
So.
Or a drug.
But that's why they made it.
I know my generation, that's all it was. Like when I say we're the stoners, like we're from the how high times and really how high and half baked and all that. And it's just how you look at it. Whether you looked at it from that lens, whether you looked at it from a lens, I'm just trying to get wasted. Yeah. People forget that lens still exists.
That's why they benefited off of Prop 64. That's why I was so against it, because I knew that in that they were going to lose the actual purpose to cannabis. It became a cash crop. People started looking at it, how can I make more money off of it? When it was never about making money. It was about helping. That's why I got into the cannabis industry, because when I started in the cannabis industry, I actually had gotten into a car accident. And I was already using cannabis to stimulate my appetite, so I'll use it for the munchies. I just didn't know. But the car accident caused me, I fractured 2 lower discs, so I was in a lot of pain. So someone told me that it would help me with pain, right? So I told my plug, I'm like, hey, the weed you give me only gets me hungry. I need something for pain. And that's when he talked to me about getting my doctor's rec and looking for that OG. So if they know, that it's something that actually does help, that's why I continue to say it benefits to keep us dumb, because the less you know, the more they can control, And I got into the industry because not only did it help me, but the people that educated me offered me a job, and they're like, do you want to work? I was like, I don't know anything about cannabis. He's like, come donate your time and I'll give you cannabis in exchange. So what ended up happening is I got so fascinated with how different strains were you know, the
what they
sativa,
were
the
doing,
blue
and-
dream, you know, and he educated me. And he used to be an Air Force. He worked in the Air Force. So he was very smart and very articulate with everything. So the knowledge that he shared with me, that's why I'm in the industry, you know? So for me to have seen something that was so compassionate, so knowledgeable, it was like, wow, it was life changing. To see it go into something that became just for money, it's heartbreaking.
Yeah.
But I'm not gonna go nowhere, because I feel that if people like me, like us, if we leave, then they're gonna continue to do what they want with the industry.
Yeah.
You know?
Yeah.
Yeah.
Well, you know, one of the things that I notice is like the regulation has got us away from the focus of the patient. Like,
Yeah.
remember, we used to cultivate for certain ailments. Like,
We had compassion programs.
right, and it's like, you know, you're looking at the data of what your customers are, you know, the customers of your collective are dealing with, and you trying to cultivate flower for them, right? Now we just done got so commercialized. It's like, what are we really doing? Are we trying to still heal people or just get them high?
Well, what you're doing is that you're still just trying to supply a demand.
Yeah.
Right.
There's a lot of humans that smoke, and they need their smoke.
Yeah.
Right.
That's what it is. You're just really trying to supply demand. It's the demand is way too big. If you ain't gonna do it, somebody gonna do it.
And also,
And then to go back to the money part, I always have like random perspectives, but trip out on this though. Even though cannabis is done compassionately, this, that, and the third, because I believe in that too. But again, I have a flip side, because I do have a Jamaican side of my family. I get like the spiritual, compassionate side, but because I was raised in Burbank, I was raised like we just went hard with anything we got our hold of. So it did kind of turn into like what real recreational is. That's the reason why some of the stores I ever was part of made a lot of bread, because I still say it till today. A lot of people overlook the fact that really a lot of the people who just spend the most, they're just using it to nobody spends more than people like me who just smoke to be fucking smokers. You know?
Yeah.
We buy pounds to smoke. You know what I mean? Like,
Yeah.
we buy half pounds to smoke. Like, if you're just buying an eighth and stuff, that's cool. But like stoner, those of us that like, oh bro, let's go, that raw shit. Really, it's those are the people I grew up with. So even though I'm rambling there, what I'm trying to get at is, when you think about these farmers though, even though it's not about money, there's still a reason why many of them had to bow out, and it's because of money. So
Right.
even though money isn't like the objective per se, because there's compassion involved in it, at the end of the day, a lot of these people were still selling to have their properties, to be able to even pay their bills. And that's why a lot of those counties and areas like that lost a lot of their farmers, because the value of the crop went down, so they couldn't survive anymore. So even though maybe the forefront and the attitude isn't about bread, it's never not about bread. Because if it wasn't about bread, they would still be here, because they couldn't afford to be here.
That's true.
Like this game, no matter how you look at it, somebody's been making
Yeah.
money.
Oh,
They
yeah.
have to,
Right.
because
Yeah.
you gotta pay your property. Even if you're tucking your bread away and you're not like a guy that's flashy or whatever, at the end of the day, you're still selling your stuff, and that's what's surviving. That's what's keeping you and your 2 generations, 3 generations of family members surviving. Now there's people from 2, 3 generations. A 3rd generation can't even continue the business anymore because of the prices.
Yeah.
There's
Right.
many of those people, right? So it's kind of about money at the same time, because if it wasn't, many of them will still be here.
Yeah.
Well, you know what? It's 2 things that I want to rebut to that. Like, number one, 280E, right? So you got 7 Republican congressmen that literally are still pursuing, like, you have the safe banking, you have the rescheduling, but then you still got them saying, no, we can never ever release 280 off of cannabis. And it's like, at a certain point, you really just gotta look and say, like, where are you driving at? Like, they don't want any competition to the synthetic drug. And how best to do that? Overregulate it, overtax it, get it to the point where it's just not desirable for the person that's buying it.
Yeah.
This is like, if you go back to 1937 and the original marijuana tax, that was exactly what was the reason in that. More people were utilizing cannabis tinctures than heroin or cocaine. So they said, well, you know what? To make up the difference of it, we'll put a tax on the marijuana. So when you buy it, we'll still get some money. Like at a certain point, the second thing you said about the legacy farmers in Morocco, they actually are going to their legacy farmers saying, hey, we want to make sure that you guys, like, let's figure this out together.
Yeah.
Like, what happened to that? Like, think about it. You had camp. You had all of these drug enforcement entities that at a certain point were trying to work with the cultivators and the farmers. What happened to the continuation of the working with the legacy farmers to make sure that they were in the future?
Yeah. Everybody been selling weed forever, man. Let's just keep that 100. You know what I'm
I
saying?
think, I did want to add to the point that you made. I agree with it. Like, there is a big recreational to that. And since we can't get rid of the legalities of it now, people need to take advantage of knowing, of having more knowledge, because if you educate your staff, and I've seen it because if a couple comes in and they're like, I only have $15, I want a pre-roll,
Right.
and your bud tender doesn't care about their job, they're not knowledgeable, and they just do it, they're just gonna sell 15. But if you have someone that chats, I got into the conversation, and then I could tell that the girl was high maintenance, she had designer everything, so I was like, okay, there's money there, and you could tell that the boyfriend was trying to impress her, and she mentioned having pain, so I'm like, hey, have you tried topicals? And she's like, no, and we happen to have bath bombs, and so I was like, have you had a bath where you put the bath bomb and it has CBD? So that $15 sell went to $170 because I added the CBD, the CBG, so we can't get rid of what we're dealing with. So if you're gonna take advantage of it, educate your staff and take care of them so they want to educate, because if you just let that customer go and you don't have that conversation and you're not making an experience,
watch them, listen,
you're missing out on money
for whatever it is that they're talking about.
And like I always tell people, if you end up overspending, that's fine, you're still going to use the cannabis later. It's not, you're not gypping anyone over.
I tell people, give it as a gift, man. I buy things and turn it into gifts all day.
I give weed all the time.
That's what I hate about me all the time. You know what I'm saying?
I was thinking about you here, man. They go a long way.
Long way. You know what I'm saying? It happens, right? You know what I'm saying? Like, yo, man, take that bob with you.
So look, here's another question I have for you guys. So I think America and their, because we've always looked at cannabis as being a medicine, right? But the recreational, like, how do you think that trend of creating a recreational market, do you feel that it hurt or helped cannabis in America?
Well, this is what I'm saying. For my demographic and my people, it's almost like when Fidel Castro said that we're just the United States is just communism hiding under democracy. He said that in Spanish many years ago when he was alive. He said that the United States is just a communist country hiding under democracy, right? So I think for many of us, realistically, I'm just unfiltered, and we all have different perspectives, but we all have different upbringings. We all come from different places, but I come from the heart of this shit. Like heavily in the valley, 818. And I'll be honest, for many of us, it was recreational hiding under the mask of medicinal.
Right. Right.
Meaning for many of my demographic and my people, we were using to use. But if the wording and the law said marijuana for medicinal, then sure, if that's what allows us to get what we want and how to get it, then we'll allow the language, because the language is what allowed us to get there. But for some groups, that's why it's for some groups, and a large group, the one that spent the most, because I've been running stores since 2003, the cats that are spending the most are just the people that look at it as users, not so much as the people that look at it medicinally. I'm just being 100% honest.
Right, but the only one difference that I see in today's recreational versus the medicinal markets that you guys had before is the collective. Yeah. See, with recreational, I'm hoping somebody come through my door. Yeah. With medicinal, I got a collective that know that, hey, I got X number of customers. and I'm trying to serve them. I'm, calling them up. I'm sending them emails. I'm letting them know, hey, I got that prescription in for, hey, I got that rare strand. Hey, are you still dealing with that?
But that's not how we worked.
Well, the collective,
Gotcha.
just being able to have a customer base.
Gotcha.
That's
gotcha.
all I'm
Gotcha.
pointing to.
Gotcha.
Right now, when you open as recreational, what you're expecting is that somebody sees value in the product that you sell, and most people that's walking outside don't even know about the product that you sell.
But neither did they for us.
Okay.
I've been doing this since 2003. I've been putting these things together. I'm just being 100% honest with you. Like,
so you think the recreational now is better than the collective that you guys had then?
in terms of how much we're making?
No.
Or just in terms of
it's other forces that's stopping the profit, but
right.
I'm just saying, just reaching your customer base.
You got to remember, dude. Like, we come from the times where there's a weed shop here, one on top of you, one to the left, one to the right. It was a dog-eat-dog world, but it was everybody had enough. But this is what made the difference, okay? What made the difference is what I was explaining, and this is the last thing I will say, but what made the difference is what I was explaining to you when I left 2 weeks ago. Mm-hmm. What makes a difference of our market back then is that it was a tourist market. It's no longer a tourist market. That's what's hurting us the most. You get me? Like, I'm coming from 2003. Like, there's nowhere else in the world that has weed shops, and you could blaze in my weed shops, and I'm passing you blunts, and you're getting whatever the hell you want. We were a tourist destination. You can't compare back then to today because the whole world was coming here to buy weed.
Yeah. Now
the whole world was
is
coming here to
weed.
buy
Yeah.
weed.
Yeah,
Every
that's
state,
true.
every city,
Yeah.
every country was coming here to buy weed. That whole experience has diminished, and it's diminished ever since COVID.
So I got a follow-up question then.
Yeah.
So national standardization, so you saying that it hurt the growth of cannabis nationally?
Yes. Well, for the state.
For the state.
Yeah.
But, okay, so for the
Because
state,
nationally,
yes.
nobody else experienced that. Once it became national, no one knew what tourism was anyways. Tourism was only us. Not even Colorado saw that. Not even Seattle saw that. Washington didn't see that. Oregon barely saw that. Colorado barely saw that. The only fluctuation of people that those states saw were the East Coasters and Midwest and down south who were just going to go get work. And go buy work because they grow a lot of shit too and they got stuff. That's the only thing. But ain't nobody going to those places like they come to Cali, because they come to Cali for Disneyland. They come to Cali for Six Flags. They come to Cali for Knott's Berry, for Universal, for Venice Beach, for Santa Monica Pier. We are a tourist destination. Yeah. No one in the world has or will ever experience what we experienced during that time when all it was a tourist destination.
Yeah.
That is completely gone. Nobody will ever know, because by the time New York has it, by the time Oklahoma has it, Maryland has it, who else? Name all the states that have it. Detroit, Michigan has it.
Well, wait a minute. I got a follow-up question to that, because you got a really, really good point, and I want you to stick to this. So if you look in current day's economy, the states that are doing the worst are the ex-slave states. Mississippi, Georgia, like they struggling right now. My question is, this cash crop that we talking about, would it be something to help turn the economy around if it was a national, commodity?
Slightly.
Maybe.
We gotta see.
But you, like,
I think
you
it'll help
understand-
individuals.
You understand the point where I'm saying that America needs this.
Yeah.
And just in this discussion that we could see it, like, why are you fighting so hard to make sure that it doesn't survive?
Yeah.
Like that, like, I went through and I just looked at, well, what are the lessons that we could learn from the rest of the world and how they rolling out this plan versus how we doing it? The rest of the world, they looking at it as a commodity and seeing where they can fit in it.
Yeah. I think what they're doing, this is just crazy because I'm high. They're just waiting for all the people who been the convicted potheads. They're waiting for like another 50 years
let
for
that
enough of us to
generation die.
die. And then it's just a new generation of people that barely knew the past, barely knew anything. They don't come from the 70s anymore. They don't come from the 60s or the 80s. They're waiting for some of us to just go.
Yeah.
So that way it's easier to flood it and
I
not
mean,
have
a
so
lot
much
of people
resistance.
did go,
because
you know?
once some of us fade away, unless we pass these like morals and feelings to our next kins, that passion and that feeling that we have will be diluted to where they're just waiting 50 years for you to be gone, me to be gone, and many others like us to be gone.
Yeah.
To where now it's easy to just, now we're gonna make it legal because there is no resistance.
Yeah.
Hey, look,
You know what I mean?
To the millennials,
Yeah.
millennials are smoking more and drinking less.
So hey, hold it
And-
down there.
And look, and I clap my hands for that because at least they listen to the one thing that we told them, that alcohol poison.
Yeah.
You're killing yourself.
Yeah, people are smoking less.
Yeah. Yeah.
All right. Well, you want to close them out?
Man, thank you. I appreciate everybody. We got my boy Keith over here holding it down, my girl Ruby holding it down, Marco, Virgil, we miss you, feel better. We just
Get
wrapping
better,
it
brother.
up. And thank you for, tapping in and checking us out on Token Tuesday.
And make sure you guys subscribe.
Exactly. I was about to say the same thing. Look at the bottom. Make sure you guys subscribe. Got Bel Air Cannabis. Look at the California Cannabis products. We got 3 locations.
look, tell them to make sure they
Melrose,
reach
Soto,
out.
and Crenshaw.
Hey, and then also, last week we talked about the letters that we write in both Robert F. Kennedy and POTUS.
Yeah.
Make sure you reach out to your local constituents and just let them know that, hey, you know what? I want holistic healthcare, and cannabis is an avenue to holistic healthcare. If you don't ask and request for it, it's still a pipe dream.
Yeah.
So let's just make sure that we let the people that's in charge know that we want cannabis and we want it now.
Yep.
Token Tuesday, it's what we do. We just sit around, smoke a pound, and talk about what we do in the cannabis world. We gon' let you know how the business go on a brand new show. Token Tuesday, show you how to do it right.